Hey, it's Angelina with another MSP lesson guide. So we have lesson 4 of dermatology, the final lesson, which is types of skin cancer. Okay, so in this lesson, students are going to be learning about the different types of skin cancer, but more specifically how physicians and dermatologists specifically how they recognize and diagnose it. By looking at different melanomas. Okay, so this is a really short lesson, which is very helpful because it is the final lesson of the unit, meaning you do need to administer the post-test. This post-test was pretty simple. Layers of skin, the 3 layers, the epidermis, dermis, hypodermis, and then what things can protect you from UV radiation, things like that. So it was more focused on the prior lessons than this one, really. Anywho, I made slides once again for this one, and I always start with an open-ended question. So it's how do we diagnose the skin? And then I had a short video about, I think it's like a mole or some kind of badger. I think, no, it's a mole going to the beach. 2 of them go to the beach, and then one of them doesn't wear sunscreen, and they have a spot on their skin later, and they find out it's melanoma. So that's pretty sad, but it was a nice way to like kind of introduce melanoma in a kid-friendly manner. And then this is the first time I showed them actual skin cancer, I believe, like actual pictures of real people rather than something that's drawn out. I felt that they could handle it this time, but I did warn them before I showed them the slides. Like, this is what you're looking at. These are real people. It's not makeup. So we went over the ABCDEs of skin cancer, and this is just kind of like a system that dermatologists and oncologists use to diagnose skin cancer. So before we got into the actual kind of ABCDEs, we talked about what skin cancer is. So it's a disease of the cells of the skin. Remember, we talked about cancer before. We talk about too much dividing and growth, and then introduce melanoma as the most dangerous type. And these do just look like moles, and some of them may have moles and they might freak out. So they might start saying, oh my God, I have one on my arm. But it's 99%. There's a 99.999% chance that the moles they have on their bodies are just benign. So please remind them that moles do not usually mean cancer, so they don't freak out. So then we actually went through the ABCDEs. So these are benign and these are malignant. You might want to use replacement words for benign and malignant. So maybe benign is just like normal, and malignant, you can just say cancerous. If these aren't really sticking. So A is for asymmetry. You might have to explain symmetry before you explain asymmetry. So talk about a mirror images, use your hands as an example for asymmetry. B stands for border. Okay, so this one is pretty self-explanatory. If it's pretty normal shape, it's fine, but if it's super oblong and weird, then it's malignant, typically. C for color. One solid color on the benign one, but the malignant one is all sorts of different colors. If you see a mix, there's typically a chance that it's malignant. D is for diameter. So this one was tough because they had to measure. In the original lesson plan, they have to measure, but my students weren't really keen with using rulers. So I instead had the stations that I'll discuss in a second on the slides. And then E is for evolving or changing. If the tumor or mole changes over time, then it is likely malignant. Okay, so in the original lesson plan, you're supposed to set up physical stations and have the students kind of walk around and work on their own. But I didn't think my students were independent enough for that, nor were they capable of using rulers. So I just had them kind of just sit at their tables, and then every station represented, or every table was represented by a slide. So I have 5 tables, and that's perfect because it's ABCDE. So table A, I had them kind of determine which one was benign and which one was malignant based on A, symmetry, B, border, C, color, D, diameter, and E, evolving. And then of course they can't measure this one, so you kind of have to like give them fake numbers. Like you can say this one is less than 1/4 of an inch, and this one is more than 1/4 of an inch. So which one is benign and which one is malignant? Things like that. Just, you know, kind of get creative with it. And then the handout packet, you can just give to them and they can color in. This is before I pass them out. This is just during the lecture. It's the only picture I have, unfortunately. But you can give them the handout and they can draw what they see on the screen as we go along, so that every student is participating and, you know, focused. This one is actually pretty good. They all identified benign and malignant tumors very well. So they're really good at that. Very little physical prep. It's really just about preparing a proper lecture, so you can get them to understand like the facets of identification and diagnosis. Yeah.